ethos here at Barnsley is NHS service improvement is part of what we try to do on a day-to-day basis, and we've had a real push to really empower all of our staff at every level in the organisation to get involved in service improvement. And the reason for making this video is we want to share our experiences and the successes that we've had in our organisation with other NHS organisations, so we can actually share the learning and share the experiences that we've had with our staff and share how we've improved the quality and safety of care that we provide to our patients here in Barnsley. Some of them have been really simple. We've had support from our commissioners with some of the things that we've put in place. An example of that would be some funding that we've had to provide a respiratory hub. But what that respiratory hub has done is allowed us to avoid admitting some of our patients into hospital. And when you speak to patients, actually, a lot of them don't want to come into hospital, and if you can manage their care in an alternative way, then that's what the patients locally would want.
We've seen about 640 patients and only had to admit 32 of those, whereas previously we would have had to admit a lot more into the bed base. So it's having a reduction on hospital admissions, which is very positive for the patients.
And I think the most important thing is that the NHS drive is to treat the patient at their home or in the community, and this is the major step to treating the patient in the community.
We've had a programme really focusing on end of life and how we can improve that for our patients, and we have symbols that identify very discreetly patients that are coming to the end of their life. And what that prevents is having to hand over to every healthcare professional and talk about what's happening to that patient, and it allows our professionals to deliver more direct patient care rather than waiting for different professionals to hand over and talk about the same thing repeatedly. So it actually makes our processes much more lean and much more effective.
It hasn't cost much money at all. The outlay has been of making the posters and getting them laminated. We've distributed them throughout the organisation, and it's about the legwork and communication tools to make sure that everybody knows in the organisation what it's about, from your domestics to your security to your staff nurses to your medical staff.
Here in Barnsley, we are very keen to improve how we deliver care to our patients, and patient safety is at the top of our agenda. And what we recognised is we wanted to eliminate all hospital-acquired pressure ulcers within our trust. Nobody wants, when they come into hospital, to acquire a pressure ulcer. And by just implementing a turning clock, we have reduced our incidence of hospital-acquired pressure ulcers by a significant amount. And that is just by a very simple initiative that's been put in place.
So nursing staff come in, they will see the patient, they then change the time to the next time that they're due. But also if physios have been in and done their assessment, they might have walked about. So again, that's relieving them pressure areas. So again, they'd change the time. We've been a trial on here, and I've promoted it to the rest of the trust. So a lot of my colleagues are getting on board with this. And it's certainly something that I'd definitely recommend throughout other trusts.
They've had a real positive impact. It's been an opportunity for staff at all levels in the organisation to get involved in service improvement. And it's not just a fad, it's not just an initiative, it's about the way we do things around here in Barnsley. And we want all of our staff to be involved from the bottom to the top of the organisation in things that will improve both patient safety and the quality of care that we provide on a day-to-day basis. And a lot of these things have done that, and we're really proud of that.